Well, good afternoon. Oh, come on. It is a good afternoon. We're together. Let me also thank our co-chairs and honored guests. We are so delighted that they are here. And as Susan said, we do have much to celebrate as pro-choice Americans since we gathered here a year ago. But I have to tell you, our success has driven our opponents to new depths of deplorable behavior. One example. The anti-choice American Life League is selling signs on its website that read, "Bury Obamacare with Kennedy." You heard it. Bury Obamacare with Kennedy. Yes, a so-called pro-life group is using the death of Senator Edward Kennedy to finance their opposition to health reform. It is so mean-spirited and disgusting. And don't dismiss this sign as the work of some fringe group. Anti-choice politicians are seeking to derail health reform efforts, and folks, the fight is not over. To some members of Congress, simply being a woman is a pre-existing condition, and reason enough to take away options or deny us altogether. True, we do have great leadership in Congress, but despite the pro-choice gains in the last two election cycles, we still don't have a pro-choice working majority. That means every choice-related vote on health reform goes down to the wire. Every woman who presently has a private insurance plan needs to pay attention. Right now, more than 80% of private insurance plans cover abortion services. That's the status quo. Yet, anti-choice politicians want to tell these private insurance companies that they cannot participate in the new healthcare system unless they agree to drop the abortion coverage they currently offer to women. In other words, anti-choice lawmakers want an abortion ban in the new system. Look, I understand how you might feel when you hear the details about vote counts and legislative process. It's enough to ruin your lunch. The truth is, we won't achieve everything we want, including the repeal of many barriers to abortion access that women already face. But we have a once-in-a-generation opportunity to transform our country's health care system. More affordable health care means women who are underinsured or lack any insurance could have access to contraceptive services, pre- and postnatal care, screenings for sexually transmitted diseases, services that will make a difference in their everyday life. And as we engage in this immediate fight on health care, we also have our eye on the future. We are engaging tomorrow's voting force, the millennial generation, the voters under 30. They are larger than the baby boom generation. They are the most diverse in our nation's history. They live in a world where technology has revolutionized how they engage in their community and act on their passions. Their relationship with history, last week, is ancient history to them. It is like Roe versus what? Many are not familiar with the significance of Roe versus Wade. They don't share the memories of the pre-Roe era of illegal abortion. Their experience is just different. It is a new kind of generation gap that we must close, and close quickly. For they will wield significant power and policies in the future and truly determine the destiny of choice for years to come. Now, we are embarking on an innovative research project to connect with these millennials now, to ensure they feel as passionately about protecting choice as they do about the important issues of climate change and LGBT equality. Our vision is to cultivate and engage the next generation, not by telling them what they should do or think, but rather by listening and learning from them. We are building this future on the shoulders of those pro-choice heroes and sheroes who came before them. Let me close today by paying tribute to Dr. George Tiller, an abortion provider who was shot to death in his church in Wichita, Kansas. That day, Americans took notice of a man who dedicated his life to serving and trusting women. And yet, day in and day out, anti-choice protesters show up outside clinics to harass and intimidate doctors and their patients and their staff. And many Americans don't take notice. Now anti-choice groups are targeting Dr. Leroy Carhart of Nebraska. They want to close his clinic too. The notorious Operation Rescue picked up their signs and bullhorns. They left Kansas and they headed to Omaha in August. So when my friend Dr. Susan Wicklund called me and said that Dr. Carhart was feeling isolated and alone, we knew we needed to get pro-choice activists to show up in Omaha. So what happened? On the day of Operation Rescue's protests, our activists outnumbered their protesters 2 to 1. We showed up. They, the pro-choice activists, showed up in Omaha and stood up for our values as pro-choice Americans. So today I ask of you, follow their example. Show up. Show up by sharing what you will hear today with 2 friends that are not here today. Show up by protecting abortion coverage and health reform by speaking up for the women in this country. Show up by making sure while we're connecting with the next generation, show up by financially supporting our research project and our work. Showing up made a difference in Omaha, and it will make a difference for women across this country if we continue to speak up, stand up, and show up. Thank you for taking that first step today. Thank you for showing up.